you.
Welcome, everybody. Thank you so much for joining us today. My name is Lori Pashota, and I'm the Executive Director of the Mental Health Association of Rhode Island. Thank you for joining our first in a series of COVID-19 workshops. We know that COVID-19 is as much of a mental health crisis as it is a medical emergency and an economic disaster. And people are feeling lonely and restless and frightened. Some of us may be grieving lost loved ones. Others may have lost a job or income. And I know that isolation adds another layer of stress to all of that. For those of us who live with any type of a mental health condition, whatever that condition is, it is most certainly exacerbated by this stress and by this isolation. So the thinking behind these workshops is that this would be an opportunity to come together, connect, learn, hopefully gain some information or strategies or coping skills. And I hope that this is of service to people. This particular workshop will provide an overview on how people with eating disorders have been impacted by COVID-19 and some practical tips for staying in recovery during this time. Our special guest presenter today is Brooke Huminski, who is a local psychotherapist in Rhode Island. She specializes in eating disorders, perfectionism, student wellness, and the healthcare workers' mental health, which I'm sure is so important at this time. She's also a guest lecturer at Brown University's Psychiatry Residence Program on the topic of eating disorders. And in addition to her own private practice, she's also a credentialed clinician at Butler Hospital's Psychiatric Emergency Room. And without further ado, I turn it over to Brooke. Thank you so much, Brooke. We're really grateful to have you here today.
Thank you, Lori. I'm so grateful for you having me here. Thank you so much for the work that you do in the community. It's been great to get to know you a bit, and thank you so much for hosting these workshops. We definitely need it right now. So I'm gonna just take a moment and share my screen, so bear with me. All right. And so feel free to ask questions as I talk. I'll pause at some points for questions. In this view, I can't exactly see everyone, so feel free to just unmute yourself and ask me a question. We can kind of do it that way, and there'll also be time for a question at the end. So today I want to help you all understand how COVID-19 has impacted people with active eating disorders and/or people in recovery from eating disorders. I also want to be a little bit more broad and just expand this to anyone with disordered eating, because it doesn't necessarily have to meet criteria for an eating disorder to be affected. Participants will also understand just the basics of eating disorders, what they are, the differences between them, how our culture sometimes impacts eating disorders. Participants will also learn some coping strategies and tools to stay motivated for recovery, prevent behaviors, and manage disordered eating during COVID. So just a brief overview of eating disorders. So the most prevalent eating disorder in America is actually binge eating disorder, which is a new diagnosis. It was a research diagnosis in the DSM-IV, the manual used to diagnose mental illnesses, and now is finally, well-deserved, recognized eating disorder, studied eating disorder. There are notably more women than men with eating disorders, though men do struggle with eating disorders as well. Something I thought is just interesting to note in terms of the body sizes over here. The average American woman is about 5'4" and 140 pounds. The average fashion model, on the other hand, is 5'11" and 110. So that really speaks to the media role, and we'll get into that a little bit more as we talk, on what we see, what we're exposed to, what our kids are exposed to. So just talking a little bit too about the dieting industry. So the dieting industry is a $40 billion a year industry. That's a pretty significant amount of money. And then there's another notable statistic I want to just point out, that children, 80% of all 10-year-olds are afraid of being fat, and 42% of all first through third graders want to be thinner. So I just thought that was interesting. This is all from the National Association for Eating Disorders, statistics about eating disorders, fat phobia, different things we want to be mindful of as we're thinking about eating disorders. So what are eating disorders in terms of their definition? And this is the real medical model definition. So we have anorexia nervosa. This is where someone restricts to a pretty low body weight. They might have a pretty strong fear of gaining weight and a very distorted view of their own body. So we have binge eating disorder, which I mentioned just before. This is my dog, Maisie. She's going to be co-presenting. Binge eating disorder is episodes of eating large amounts of food and a sense of control, lack of control over eating during those episodes, and distress around those episodes that occur greater than one time per week. And then we have bulimia nervosa, and this is where there are episodes of binge eating and also compensatory behaviors such as purging, laxative use, exercise, and that's aimed at preventing weight gain. And there's also here, just as in anorexia nervosa, a high value placed on body shape and weight. The next category we have is other specified feeding or eating disorder. This was known in the DSM-4 as EDNOS, and it contains atypical presentations of eating disorders. So this might include people who have low frequency or limited duration of eating disorder symptoms or other types of eating disorders. Pica, rumination disorder, ARFID, which is more common in children. I won't be touching upon too much here, but it's also an important diagnosis. Then there's unspecified feeding or eating disorder, distressing eating disorder symptoms that do not meet full criteria for a more specific eating disorder diagnosis. I want to just call attention to the last two categories because as a clinician, in my peer groups, we tend to see a lot more of these bottom two diagnoses, these mixtures, or something called atypical anorexia, which in the field is a bit controversial because people can develop this picture that looks like anorexia, but be at maybe a stable weight or maybe be at a higher weight, but still meet criteria for anorexia nervosa. So a lot of us believe this should just also be called anorexia nervosa, not atypical, but so far it's called atypical. So eating disorders are pretty diverse. Even with the DSM-5 adjustments, there are many different ways an eating disorder can present, and also ways eating disorders can sometimes transmit, so you can start off with more of an anorexia nervosa presentation and transfer to binge eating and all different variations. I just want to briefly go over this cycle here. This is a cycle of binging that I found on the Meta website. Meta is this great organization right up in Newton, Massachusetts that does a lot of advocacy work. They do a lot of training for clinicians, and they also do support groups. And this cycle of binging typically starts with restriction. So it starts with eating less than the normal type of food. So restricting your food in some way. It could be either the amount you're eating or the types of foods. And then typically people struggle with that because that's not what our bodies are meant for. And that leads to feeling maybe obsessed with food, feeling really hungry, thinking about food all the time, cooking a lot. And then typically what happens in the binge restrict cycle is that the person then gives into the cravings through a binge. They feel worse than usual. They feel out of control. Then after that, they struggle and feel ashamed, regret, and binging. And a lot of times this can start with a very innocent diet, starting, Weight Watchers, starting something that, is well-intentioned and supported by our culture, but often leads to this cycle that becomes really tough to get out of. So I'm really grateful to just have this opportunity to talk about eating disorders today. I love this quote from a NAMI site in terms of, I look forward to the day that information about eating disorders is common knowledge. As most of us know in Rhode Island, there's a lot of wonderful outpatient providers, a lot of wonderful advocacy going on. And also we have a limitation in terms of access to higher levels of care. And as someone myself who recovered from an eating disorder in Rhode Island, this is something I'm passionate about in terms of advocacy, talking about eating disorders, educating providers and the community that eating disorders exist. They don't just go away when someone gets older, and they deserve equal care. So again, really grateful to be here today and for this opportunity. Any questions about eating disorders, what they are, the breakdown there? So jump right into COVID-19 and eating disorders. I apologize that this graphic didn't come up exactly as I would have liked, but what it says here is that 40% of women and 46% of men agreed that it would be worse to gain 26 pounds during social distancing than to become infected with COVID-19. This was actually a study done by the Center for Body Image Research. And I didn't go into the study, but I was shocked by this statistic. And it says on this graphic that this is diet culture, this is fat phobia. I mean, we are talking about COVID-19, which is, killing people, and our, population is more worried about gaining weight. I think that, speaks to a culture that's pretty sick. So I'll keep going past there, but just wanted to point that out, that there's already been some research done here. There's been a number of challenges during COVID-19, and I'm going to list as many as I could think of, but there are certainly more, and I would love your participation if you thought of ones I didn't think of. So the first one I saw, especially with my clients, is a pretty strong decline in recovery motivation. So everything's shutting down, all my coping strategies are going away. Why should I even bother working on recovery right now? Why don't I just wait until this whole thing is over and then I'll work on recovery? And I get it. I get this whole, feeling of feeling so overwhelmed. Your whole life is changing. At the same time, while decline in motivation is happening, there also has been this surge in diet and fitness culture. So everywhere, on social media, in workplaces, people are hearing about, the COVID-19 or this weight gain phenomenon. And I don't want to give it too much lip service because I think that's a way of spreading it. But there has been an increased number of talks about diets or making sure people are getting enough exercise or staying active. So a lot of people I work with eating disorders are saying, well, I don't feel like I deserve to eat anymore because I'm staying inside all the time. When in reality, they're probably not moving much less than they typically would if they were going to work or going to school. But there's such a focus on it and such a panic that has been another challenge of COVID-19, and everyone staying inside or conversely feeling pressure to get outside. And not that fitness and movement is a bad thing in and of itself, but when it's paired with an eating disorder, it can be sometimes really problematic. So then this whole staying inside, and especially at the beginning, this increased accessibility to food and this run on the supermarkets. I know I walked into Market Basket at the beginning of this, and there were no more shopping carts. I've never been in a supermarket where there's been no shopping carts. So I carried my bread and I carried my yogurt and I carried the food I needed, but obviously couldn't get too many things. And then there was just this sense of overwhelm and panic. And again, what I've heard from my clients is this feeling of scarcity. And for people with eating disorders, I think that's a specific fear that comes up either maybe from being raised in a family where there actually was food accessibility issues, or maybe there was a family culture where certain foods weren't allowed, or families would put kids on diets from a pretty young age. And again, I'm not blaming families or parents for eating disorders, just eating disorders are caused by a complicated number of factors, but sometimes scarcity is one of those pieces. And even now, going to the grocery store is quite an ordeal, right? The typical stores I go to, I have to wait in line, or I have to wear a mask, or I have to, navigate trying to follow these signs with which way to go in the grocery stores. So on a good day, a lot of the clients I work with struggle just with getting to the grocery store. Forget a pandemic, just going into a store and picking out different food choices is a really hard part of having an eating disorder. So in addition to that, there's also been this isolation that's been occurring from friends, from a family that isn't necessarily immediate family, and then switching to virtual sessions with your treatment team. If you're, used to seeing your therapist, your nutritionist, your medical providers, your psychiatrist in person, and you have that relationship going, it can be a pretty big loss to go switch to virtual. And I know at the beginning, that felt like a really big shift. And as a therapist, I much prefer seeing my clients in person. I think there's just this magic that happens in the room that is so important for both of us, but especially for clients and consumers to feel like there's someone there who gets it and cares for them. So that isolation, switching to virtual sessions, and then the deepest loss from COVID-19, actually losing a loved one, or even, hearing about people who are losing loved ones. So that sudden loss, that grief, that worry about people that you love. I know I have most of my family in New York. So when New York was being heavily affected, I was really worried. Also have family elsewhere in New Jersey and Florida, and just different places that I was really worried as a person, just, will my family be okay? And then you hear of someone else who lost their father, or lost their colleague, or lost, someone that is really close to them. That's absolutely going to impact your recovery, your motivation for recovery, your willingness to work on things. And I think it's just collectively traumatic to be in a culture that's facing all this sudden loss, and not knowing what's going to happen next. So the kind of loss of this sense of safety that we all tend to live with, being in a pretty secure, non-wartime country, having this sudden grief and trauma come up. So some more challenges, and again, I appreciate anyone kind of adding to this. So just now that we're thick in it, this lack of structure that has come up. I've seen this especially in my college student population, who have gone from having plenty of things to do, activities, maybe working on top of going to school, now not being sure when they should get up, or not being sure when food should happen, just this lack of structure with meals, lack of structure with their day-to-day activities. Conversely, we're seeing some increased responsibilities in my older clients who are parents. Now they have to not only do their job, they have to teach their child and provide childcare at the same time as they're working. For my healthcare provider clients, they are going to work at the beginning with a lot of fear of not having enough PPE or protective gear. They're not being sure if they're going to be able to take lunch breaks. They're not being, they're scared of taking home this illness to their family or their loved ones. So there's this balance and variance of experiences that might lead to increased responsibilities. So I talked a little bit about the limited access to food and the stressful grocery shopping and the scarcity. And how about just general health anxiety, being more afraid of catching something. I can't remember any other time in my life where I've had to go outside and worry about getting sick just by taking a walk with my dog, right? So if you're already struggling with a mental illness, that fear and anxiety on top of baseline levels of anxiety that we know can often coexist with eating disorders, is just going to be really, really tough. And the way I've seen this specifically touch eating disorders are for my clients with co-occurring anxiety and OCD, who might have fear, contamination fears around their food being touched by someone who's ill, back when before we were social isolating, and just some specific fears around contamination and compulsions around hand washing, and kind of a very classic OCD symptoms, and worrying that those are going to get worse in light of all the public health precautions we're being asked to take. So I can't leave out of this talk the economic difficulties that you already brought up in the beginning of this presentation, that some people just frankly have lost their jobs, have been furloughed, are on unemployment, are not sure when their next paycheck's going to come in, if they can get a job. Maybe they're older. I have certain clients who are not sure if they can even afford therapy anymore. And obviously, there's a lot of us in the therapy field who are offering our services at very cost to be accessible. But there's a tie in this country of insurance to your job. So if you lose your job at a time where you desperately need healthcare, right? During a pandemic and access to mental health care, there's a ripple effect that happens with that. So I've seen that economic difficulties also tie in with eating disorders and the stress, and then people either restricting or compulsive eating or binge eating. And then economic difficulties also of spouses. And that's another area I think people might be forgetting. Even if your job is stable, maybe your loved one can't find a job or lost their job and is now struggling with their own mental health issues. So your stress and your responsibilities are increased. And lastly, and again, there are I'm sure many more, just a ton of uncertainty. You know, as we sit here today in Rhode Island, there's talk of things opening up, and there's also more cases, and we don't quite know what's happening next. And I, as someone who lives also with anxiety, you know, uncertainty is the enemy of anxiety. You know, I want and crave certainty, and so many of my clients have just been saying, I don't know what's going to happen next. I don't know if I can start grad school. I don't know if I, you know, can even go to treatment. Are there treatment centers taking people? And just the juggling, and I probably could have added that one in there too, just the juggling of a lot of programs going virtual, a lot of partial programs going virtual, which is wonderful and accessible, but also different. And then wait lists at residential facilities, and trying to figure out how to transition people to higher levels of care when they need it. That's also been compounded by COVID, because now there's like these quarantine restrictions based on state to state. So a lot of challenges. Are there any that maybe I didn't address that either you've been seeing in your clients or you've been seeing in yourself or in your organization that you feel willing to share right now? Yeah.
This is Lori. I have personal experience with eating disorders. I recovered from anorexia nervosa when I was 17 years old, and I did the whole treatment stint. I did 4 weeks of residential, 4 weeks of partial hospitalization, and then 18 months of outpatient therapy before college. And I haven't had any episodes of restriction, but I would say that I struggle in sort of the opposite way, where different times in my life I've been more of a stress eater. So that's been particularly challenging during this isolation period, because as you mentioned, there's a lack of structure. You know, you make your own routine every day. The isolation, which is stressful. And then you have access to your refrigerator all day long. You know, instead of going to an office and having a lunch packed and some snacks packed, now I just have my whole refrigerator there. So if I'm feeling anxious or bored or stressed or lonely, you know, I have a tendency to snack a lot. And I'm not hungry, my body doesn't need it, but I'm doing it because it's a way of like distracting myself from these really unpleasant feelings.
Yeah. Thank you so much for sharing that. It's absolutely something I've seen too. And I think that access to food is so different right now. If you're in your house all day long and you're stressed out, right? And that's a pattern that comes up. I would say that's even like a normal thing that's happening. I like hesitate to call that like a pathological reaction, or, you know, I think just that I've heard that from my colleagues at Butler. I've heard that from my clients, and I've heard it from my friends. I've experienced it. I was very fixated on these jelly beans in particular around Easter that I just had to have in the house. And I'm pretty solid in my recovery too, but just felt like, you know, food, we use food for comfort, and we're all feeling stressed, and but also kind of balancing that with, you know, what else can we do when we feel stressed out, and how do we cope with some of that. So thanks for bringing that up. It's a great point. Anyone else? Okay. So I'm going to move straight along into the solutions. I really think it's important to talk about how do we help each other through this, and how do we stay connected. I'm going to break this down into different pieces. So I'm going to first start with how do you stay motivated, and then I'm going to move into actual coping strategies. And I'm going to talk a little bit about our culture and how do we kind of stand up to diet culture a bit. So in terms of staying motivated, what I've been recommending to my clients, and what I recommend is remembering why you started on your recovery journey. What was that pivotal moment? Maybe it was talking to a parent, maybe it was talking to your partner, maybe it was waking up just one more day with the eating disorder and realizing you couldn't keep going with it. And then making a list of those motivating factors and sharing them with someone you trust. This can be, you know, a friend, this can be a parent, this can be a treatment provider. And then obviously talking with your loved ones, your treatment team, if you just can't remember your motivation. Something else that can be really helpful in terms of staying motivated and remembering your motivation is connecting with some type of recovery community. So I already mentioned Meta, which is a wonderful organization. NEDA is the National Association for Eating Disorder, or National Eating Disorder Alliance Association. Sorry, I can't remember the acronym right now, but they have some wonderful resources. You actually just go to their webpage and it has like a pop-up for COVID, and it tells you all these different supports, including this really cool one that came out pretty early on, and it's on Instagram, and the way you find them is it's at COVID-19 Eating Support. And what they're doing is free meal support all throughout the day. Like I pop on Instagram pretty often during the day, and I will see like COVID-19 eating support going live. And it's different people who have recovery histories, different professionals, different advocates who are helping people who might be struggling with their eating in one way or another. It can be either be restricting or compulsive eating. So this is something you can either volunteer for if you feel like you want to help other people, or you can participate in. And it's really cool. I joined it once, and it's just people like eating together. And that I think can really help the isolation piece. You know, if you're now working from home and used to eating lunch with people, just having that eating support to break up the isolation and also strengthen your recovery. So I want to talk a little bit about prevention before we get to managing urges when they come up. So we talked a little bit about the difficulty with structure. So I'm asking my clients to create structure where there isn't. If you don't have a morning routine and an evening routine, I want you to create one that feels okay for you. And I don't want you to make it rigid. You know, I have to do this every day, because we're going to feel different every day. There's this like COVID roller coaster that we're all on emotionally, myself included, that, you know, some days we're going to wake up with a lot of energy. Other days it's going to be a struggle to, you know, get out of bed. And I, again, don't think that's pathological. I think that's just a reaction to the shared trauma. So creating structure can involve the events you're doing your day, but also with food. You know, a lot of times when we don't have structure in our day-to-day, sometimes maybe when we go on vacation, this happens, or early on in recovery, we want to just schedule our meals a little bit more. So at this time of day, I'm going to have this, and this time of day, I'm going to have this, and this time of day, I'm going to have that. And adding maybe some snacks in there if you find yourself snacking anyway, legalizing your snacks. And I want to make sure I'm prescribing this without rigidity, because I know a lot of clients I work with will say, oh, so what do you mean? What do you mean exactly? Because the eating disorder wants to know precisely how much you can eat and at what times. And I'm not saying to do that. I'm just saying having some rough guidelines. And I always ask my clients at the end of our sessions, any intentions for the week? And I want you to think about this more in terms of intentions. So what are your kind of food intentions for the day? You know, having 3 meals, having 3 meals and a snack, having 3 meals and 3 snacks, you know, wherever you are in your day-to-day, but making sure you're picking some food that you have accessible to you. So I already mentioned this, but I also recommend legalizing snacks. So as already discussed, I think, again, it's really normal to be snacking more. And when this has come up with my clients, I try to tell them, like, you might be moving more. You might not think you're moving more, but a lot of people are going on all these walks all day long with their poor dogs who are freaking exhausted. So, you know, they are actually moving a bit more and probably a little more hungry. So if that's the case and you are more hungry, making sure you're having enough food to compensate for that. I want to also legalize delicious foods. You know, something I did when I did my like pandemic grocery shopping is I bought like this delicious, expensive chocolate because I thought like the world was ending. I might as well enjoy delicious, expensive chocolate. But really having foods that you enjoy that bring you comfort. Maybe it's like a family recipe. Maybe it's something that you wouldn't normally have, but can have access to. And then also legalizing different foods. You know, a lot of us aren't going to the grocery store as much. So we might have food that is more, you know, stuff that you keep in your pantry, things that you may not usually eat if you're used to having more fresh foods. But all of that food is food. And I want you to try to take the label off of it as like processed or unprocessed or fresh or, you know, all these labels that sometimes can come with the eating disorder around food. You know, a balanced diet is, everything in there, unless you have some type of allergy or, of course, intolerance. But making sure you're having all different types of foods, you're enjoying the food you're eating, and you're being flexible with your planning for the food. So another way to start preventing behaviors is practicing a technique called thought diffusion. So for a lot of my clients with eating disorders, especially if they're feeling like they're sitting at home all day, they're having more thoughts coming up. They're telling them they're fat, telling them they're not good enough, that they're not being productive enough. And I appreciate that those thoughts are just stronger right now. And being alone with your thoughts all day long is torturous, right? That's awful. So one simple technique that is simple to say, but also hard to practice is thought diffusion. This comes from ACT therapy model. And it's putting, if your immediate thought is that I'm so fat and lazy for sitting inside all day, I want you to, still not push away that thought, but add this phrase, I'm having the thought that. So I'm having the thought that I'm fat and lazy all day. So you're creating a little bit of space and distance. You can also add to that, I'm having the thought that I'm having the thought that, and that creates more space in there for you to just not get so stuck to the thoughts that come in, because we all have so many thoughts. Our brains produce thoughts all day long, and just not all of them are true. Another thing we commonly do in eating disorder treatment is helping people label the eating disorder thoughts versus their healthy voice. So making sure if you're having those eating disorder thoughts, that you're labeling them as such and not buying into them, and really questioning if you're, where those thoughts are coming from, and then what actions you're doing after them. So the next area of prevention, I'm briefly skimming over all of these, but I wanted to include as much as I could in here, is clarifying your values. And this also comes from ACT. How do you want to come out of this is a question I've been asking my clients. Do you want to come out of this with more eating disorder symptoms, with lower motivation, with things that are going to, make you feel worse? Or do you want to use this time to really delve into recovery and really practicing things that will help you have a bigger, richer life on the other side? So this also builds a bit of future orientation, because right now we're so focused on the immediate, but it can be helpful to remind people that we all still have goals for beyond this, right? Like yesterday I created a little, in my banking app, I created a vacation fund. I'm not going on vacation anytime soon, but I want to know that vacations are still happening. And we want to be in a healthy place for those vacations or those dreams that we have to happen, whether it's in a graduating college, going to college, doing something fun and enjoyable. So the next two I'm going to talk about a little bit more in the following slides, but briefly it's practicing mindful self-compassion and staying connected with your supports by practicing opposite action. So I'll delve into those next. Any questions about those? So mindful self-compassion. So a lot of eating disorder thoughts are not compassionate, right? They're not the kindest variety of thoughts. And self-compassion, especially mindful self-compassion, can be a bit of an antidote to those rigid, demanding eating disorder thoughts. I picked these three quotes out because I like them. I'll talk about each one. Self-compassion is nurturing yourself with all the kindness and love you would shower on someone you cherish. So this is asking yourself, am I talking to myself in a way that I would treat and talk to a friend? If the answer is no, you might want to reevaluate those inner dialogues you're having and consider what you would tell someone you loved. Another one I posted recently on my social media and got some positive feedback about is this middle one, which says, you've been criticizing yourself for years and it hasn't worked. Try approving yourself and see what happens. And I don't mean to imply that these are easy or easy to do. This is a practice like everything else, but it's really just starting to notice those thoughts that are judgmental, that are driving the eating disorder, and practicing compassion to yourself. And compassion isn't just softness, and it's also the firmness, like I need to have a meal right now, or I need to check in with my hunger cues. Am I actually hungry, or am I eating out of boredom, and can I do something else to help nourish myself in a real rich way? And then speaking to that point that this does not have to be a big radical change, A moment of self-compassion can change your entire day. A string of such moments can change the course of your life. I know for me personally, when I'm feeling really stressed out or self-critical or perfectionistic, which we know a lot of those things can go along with eating disorders at times, or be leftovers in the sake of, recovery, that if someone's nice to me, if someone's kind to me, if something goes a little bit easier than I thought it would, that just makes such a difference, especially now when everything is just so hard. So really just starting small, practicing with little things you can do to be kind to yourself, whether it's being with your pets, whether it's being with your loved ones, whether it's noticing the flowers outside, again, building that practice of mindful self-compassion. And there's so many wonderful self-compassion guided meditations. And one of my favorite apps is Insight Timer because it's free and it has just a broad variety of meditations. Headspace is another one. There's lots of great ones out there. And Chris Germer is one of the great researchers out there, along with Kristen Neff. And there's a lot of wonderful stuff out there on self-compassion. So opposite action is a skill from dialectical behavioral therapy, which is a model I practice from, that I want to talk about a little bit with relationships. So something I've been hearing from people, especially clients I work with who maybe live alone, are that they're feeling not as motivated to connect. We all can connect over Zoom, over FaceTime, but we know it's just not the same, right? It doesn't feel as good as being across the table from someone or across the room from someone, especially when it comes to close friendships, family members, treatment providers. So then there's been this shutting down, well, why should I even bother? And so opposite action is a skill that teaches us to do exactly what it sounds like. The opposite of an action urge when the emotion is very, very intense or not leading to an effective action. So an example of this would be if it was normal times and I wanted to go to the beach in the summer and it was kind of raining out, and then I go to the beach anyway and I pouting and sad and why can't it just be sunny out? And I'm just angry at the weather gods. But then circling back, the opposite of that would me being okay, it's raining, I accept that, a little bit of radical acceptance in there too, that I'm gonna maybe spend time with my friend and go to the movies instead. I'm gonna do the next best thing. And we don't always have to love, what we decide to do, again, pairing a little bit of radical acceptance with opposite action. But we wanna be careful about isolation. So isolation and secrecy and shame all fuel eating disorders. And if you find that you're kind of leaning in that direction, I just want you to be mindful of that and be aware and ask yourself, is this something that I need because I'm more introverted and I'm kind of exhausted by all those Zoom calls and all those, flurry of stuff that I think happened more in the beginning and it's easing up a bit now? Or do I really need to meaningfully connect with someone? And these things can be hard to sometimes remember. So maybe making a list of different things you want to do during the day, putting that either on your phone or at your desk or your workspace or a place that you're going to see them. And we might not feel like doing it, but it's doing the opposite of what we're feeling like if the action urge isn't effective, right? So I'm not saying be on Zoom meetings all day long, but if you feel like you're isolating and it's leading to worsening mood, worsening eating disorder behaviors and thoughts, then you want to practice some opposite action. So, what if prevention isn't enough and you get into the point where you're having urges to use behaviors, really common with eating disorders? So I'm going to teach you just some different skills that there's a lot of more information about online, but for the sake of brevity, I'll just kind of skim through them and ask if you have any questions, let me know as we go through or after. So some of my favorite skills in terms of managing urges, and these can be urges to binge eat, compulsive eat, restrict, or purge or exercise, are just stress tolerance skills. So we all experience stress in our life. That's unavoidable, that's just a given. Thankfully, we can also decide to make decisions and use different skills that help us get through difficult urges so we don't engage in behaviors that contradict with our recovery or values. So the tip skill, and I'll briefly go through this one, is one that I recommend first to clients, especially clients who struggle with purging, or self-injury. So the T stands for temperature. This means you either focus on something hot or something cold. And if it's something cold, it's something like maybe a frozen orange or frozen vegetables, or an ice cube. Because if you think about it, when you're in the cold or holding something cold, really all you can think about at that moment is that you're cold, right? You're probably not going to be thinking about anything else at that moment. In terms of heat, you maybe want to think about taking a warm shower. You also want to be a little careful with this one that it's not too hot, that you're not injuring yourself. But just, again, maybe like a warm compress, some warm heating pad, engaging just that sensory system. The I in there is intense exercise, and I say that with a word of caution in an eating disorder talk, because that's not meant to do a 60-minute run. That's meant to do like 15 jumping jacks, if that feels safe for you, if you're cleared to exercise, but just to activate that system and help your body calm down a bit if you're in a high level of distress. The P is for paced breathing, and that's breathing in to maybe a count of 5 and exhaling to a count of 7. And you want your exhales to be longer than your inhales because that helps regulate your body and helps calm your heart rate down. The next P is for progressive muscle relaxation, and that's where you literally just go through your body, either starting at your head or your toes, and go up or down throughout your whole body, and each muscle you want to tense and release. So if I start with my head, I might start with my face and make a funny face, tensing all my facial muscles up, and then tense my shoulders up and down, and then go all the way through my body. And there are some wonderful scripts on this online as well, or in those apps I mentioned. The next skill that is a distress tolerance skill from DBT that I highly recommend are sensory skills. So these attend to our sight, our taste, our smell, hearing, touch. Something that I've been mentioning to clients and helping them focus on is their living environment, right? So if you're sitting in the same room all day, which most of us are, you want to make sure it has something in it that at least brings you comfort. So I know in my office, which is my dining room, I have essential oils from a diffuser. I also have some knitting to do in between clients. I have a soft chair that I'm in, and just some sensory experiences that can help you manage these urges to use behaviors or just make your living environment a little more tolerable. Another skill is to notice the state of mind you're in. So this is the second point. And in DBT, there's 3 states of mind. There's emotion mind, rational mind, and wise mind. And we all float between these 3 different spaces. And you can think about it as overlapping circles with wise mind being in the center. And all you do here is want to notice, if you have an urge to use a behavior, are you in emotion mind? Are you feeling really angry? Are you feeling really irritable, really depressed? And if you are, how do you get to a place of wise mind and then make a decision from there? And again, you might want to use some of those distress tolerance skills that we talked about already to get you back to that place. If you're in rational mind, you're totally detached from your emotions. You may want to do something to evoke emotions, like watch a nice movie or listen to a playlist. I know some people I'm close with are just making COVID playlists to have, at the ready when strong urges come up. And then making some type of coping chart. No one's coming into our houses right now, so feel free to put stuff out there, on your wall, on your mirror, that will help give you a visual of ways you can cope. And this is something you can either come up with your therapist or just come up with through different ideas. You can also put this on your phone as a way to remind yourself of different things to do. And even if you don't have an eating disorder, I think this is a good idea just to have like a COVID wellness checklist to make sure you're just managing different stresses in different ways, because it can really sneak up on you, I've found. And then some accountability. So we're missing a lot of that accountability when we're not as socially connected. Recovery Record is this great app that your therapist and you can use together to monitor just different food that you're eating or different thoughts coming up around that. Again, not in an obsessive way, and it's not designed to be that way, but just to help build skills. You can also build some accountability, talking to your family, talking to a partner, talking to a friend. Another way to cope with urges, really strong urges to use eating disorder behaviors, is delaying the urge. And this sounds quite simple, but in practice is pretty challenging, right? So setting a timer on your phone or on your microwave and saying, okay, I'm not going to do this behavior right now, but I give myself permission to do it in 5 minutes. And then you get to the 5 minutes, say, okay, 5 more minutes, and then so on and so forth. And hopefully you're able to delay the urge completely. If you're not, any progress is progress. So give yourself credit for that. And then pure distraction. There's never been a time where I think like Netflix shows have been more helpful and useful in terms of just getting us out of our present moment. Because if we're conscious and thinking about COVID-19 all the time, that's just going to raise our stress levels. We're not going to be able to re-engage in our life. So maybe picking a show or two that you're really into, maybe finding a friend who's watching it too, and doing some distraction or reading. A lot of people I know are just ordering some different books on Amazon or finding ways to use their library apps to get different books or different ways to distract. So I know sometimes when we talk about like coping with urges and just coping skills in general, it can be like, well, I've tried those and they don't really work, and I need something different. So I commonly recommend people pair things together. So lighting a scented candle while listening to an audiobook, petting your dog while watching an uplifting movie, crafts that could be done at home, such as puzzles, knitting, collaging, or photography. And then there's this great list, and you can just Google Zen Care and Big List of pleasant activities. And they made a special one based on the DBT Big List of activities just for coronavirus. And there's like many, many ideas on here. So if you're out of ideas, if you and your family are just done with all the things you usually do, I would check this list out and figure out if there are things on here you haven't tried and you want to try. So lastly, I want to just make sure we include a little bit in this talk about talking back to diet culture. So as I mentioned before, in some of the things that are coming up around COVID, there's a lot on social media right now that is harmful. There's a lot of things that are really, just not geared for people in recovery. So I want you to, really consider doing a social media sweep, following people that will help you on your recovery journey versus hinder. You can follow some hashtags. I love the health at every size hashtag and body acceptance hashtag, because that will automatically bring up people who are recovery oriented. And you also want to be mindful at work and at home. If there's diet talk going on at work and home, you can't always control that, right? That's just the culture we live in. But you can, change the conversation or ask someone to talk about something different. And if it's someone you care about, one of your loved ones, you can have a frank conversation about it. And use some interpersonal effectiveness. So that's like being effective in your relationships at work and at home. So I know we're pretty close to the end of time, but just thinking about maybe what has been the hardest for you during this time, what may you practice from some of the ideas discussed, anything else that's on your mind today. And then I put some resources here. There's a quote I really like. It's your reaction to adversity, not adversity itself, that determines how your life story will develop. I put ways to connect with me here. I'm on Instagram. I'm pretty active also on Twitter. I've written a couple articles on Medium. Then National Association of Eating Disorders has a wonderful list of resources. Meta, the organization I mentioned earlier, Zen Care is a great site to find therapists. And then they actually made an app. The VA, I believe, made this app. It's called COVID Coach. And it has different skills you can use. And I downloaded it, and I've been frankly using it myself. I find it really helpful just to check in about where you are with mental health. So I thought this is a free resource, and I wanted to make people aware of it. So that's all for me.
Thank you so much, Brooke. That was incredible. That was so informative and reassuring, and I took a lot of notes. So for me, this was personally meaningful, and I really appreciate that you did this. I wrote down a lot of what you said, and I'm going to implement it. I would like to open the floor to anyone who has a question. Please feel free to unmute your microphone, which is at the toolbar at the bottom of your screen. If you put the cursor at the bottom of the screen, a toolbar should pop up, and then you'll see a microphone with a red line through it. You click that microphone and you should unmute yourself. But but I would love for people to ask questions or share if they're having an experience. I have a question.
Sure.
Do we have any local support groups in Rhode Island for people in recovery from eating disorders?
In normal times, Be Collaborative Care, there's definitely 2 groups that meet there. One, I believe, is on like a Wednesday, another one is on a Saturday. So they probably on their website or at least their social media would have an updated list of that. And Betsy Brenner is a wonderful woman who leads one of the groups, and Karen, I'm forgetting her last name, Karen Lewis runs the other one, I believe also with Betsy. And they're, I wonder if they've moved to virtual or not, but that's something I can certainly find out more and get back to you too.
Thank you.
Yeah.
I think I'll put that on our, we have a COVID-19 resources webpage, but I may put collaborative care on our regular resources page under the category of eating disorders.
Yeah, Be Collaborative Care. It's so
collaborative.
Yeah, and they have a full website. My colleague and I are starting a DBT group for COVID. That's going to start May 20th. It is limited to like 8 people, so that's a smaller group, but we personally like use these skills all the time in our life, so we want to help people. It's not eating disorder specific, but it can help people with eating disorders too.
Is that open to anyone, or is it through a particular insurance?
So it's not through insurance. Unfortunately, she doesn't take insurance, and I only take one, but you can get reimbursed through your insurance. Mm-hmm. So we can give you receipts for that, but it's open to everyone.
Thank you.
And it's virtual. And what else? I know Carol is with us, and she works at Walden. So if she pops back on, she can give you some more information too.
Walden's fantastic.
Yeah. What'd you say?
Walden's fantastic.
Yeah, I used to work there. They're wonderful.
Oh, wonderful.
And I know a lot of the treatment centers are doing virtual like programs like PHPs and IOPs. Places like, Walden and other places where it's not in state, but you actually could get it in state. Like you could stay at home and go to a treatment program out of state, which I think is a unique experience for Rhode Islanders. So that's pretty cool.
That's great.
Yeah.
Any questions from the audience? Any comments?
This is Jen. I just wanted to say thank you, Brooke. I thought, while I haven't had experience with an eating disorder, I felt that a lot of what you were saying was just generally specifically helpful in this whole, how we're dealing with COVID-19, and just the techniques that you talked about pairing, I thought were really good, and some things I haven't tried. So I'm looking forward to trying them. So I just want to say thank you, that I think they were just helpful for anybody during this time.
Thank you. That's really helpful to hear. Really appreciate it.
In general, I would love to ask the audience, what do you need right now during this crisis? What do you need? Well, you can always email Brooke after, or you can email me after and let me know if there's anything the Mental Health Association can do to help you. If you need a referral to a provider or a particular resource, the Mental Health Association website has a COVID-19 resources page, which contains local and federal financial resources, as well as prescription assistance programs and support, tips for parents who are homeschooling, tips for providers. So if there's anything we could do to help, anything you're looking for that's not there, please let me know. I can try to find it for you.
Awesome.
Any other questions, comments? Well, thank you so much, Brooke. This was fantastic. I feel inspired and feel like I'm on a good path again.
Awesome. Yeah, stay in touch, everyone. And thanks so much for having me. I really appreciate the opportunity.
And everyone, I just want to remind us all that we're not really working from home. We are at home in the middle of a crisis, doing our best to work from home.
Yes.
And, each day is different. Each day brings different feelings. So be compassionate and patient with yourself and with the people around you.
Yes. Thank you for that reminder.
Thank you, everyone. Have a great day. Please join us for our next webinar this Thursday, which will talk about homeschooling best practices for parents.
Awesome. Thank you so much. Bye.
Thank you. Bye-bye, everyone.